This is Dr. Kathryn Dao reporting from the ACR meeting 2019 in Atlanta, Georgia. So today what I'm going to talk about is Michelle Petrie's pearls. So Petrie's pearls have been really good. I went to this industry-sponsored dinner last night. I wasn't sure what to expect. I mean, she was talking about damages accrued in lupus, and it started out just a little bit slow, but then it really picked up pace fast. And I am so glad I went because it's, hands down, one of the most important lectures that I attended during this meeting. And most of the learning actually was after she finished her presentation, when people were asking all these questions of her, and especially about hydroxychloroquine. So one of the things that she had mentioned is that if patients have hydroxychloroquine intolerance, now this is people who can't tolerate it because of GI issues, then think about prescribing brand name. The brand name Plaquenil actually is coded, and therefore people will have less GI intolerance. Now the other thing that you can do is actually coat generic hydroxychloroquine with butter. It'll make it dissolve more slowly. Who knew? To dip hydroxychloroquine in butter? For real? Okay. So the other thing that she also mentioned is that, it's not about whether or not you give patients 5 milligrams per kilograms a day of hydroxychloroquine, or if you stay with 6.5 milligrams per kilograms per day, or stay with 400 milligrams per day. What's important is their hydroxychloroquine blood level, not serum level, blood level, okay? So it's the blood level that's important because it's just like the hemoglobin A1C. It gives us an idea of how much hydroxychloroquine is in the patient's blood over the last month. All right. The other thing that she also mentioned is, patients who have chronic kidney disease and hydroxychloroquine. They always mention that you should reduce the dose. Well, how much and what's considered, chronic kidney disease and the severity and things like that. So what she says is that if the patient is end-stage renal disease on dialysis, she does 200 milligrams after dialysis days. Okay, so that's just 200 milligrams. She did check levels of hydroxychloroquine, blood levels again, and she did find that it is subtherapeutic, but that's her maximum tolerance. And then the other thing is that for patients who have a GFR of less than 50%, what she does is just give them about 200 milligrams, half the dose, 200 milligrams a day. So that's her rule of thumbs. And then one other thing that she had also mentioned during her Petrie Pearls hour is that she still uses DHEA. All right, and some of you may have remembered the old recommendations and the lecture that she gave on DHEA and how it could decrease the use of steroids and perhaps decrease the risk for glucocorticoid-induced osteoporosis, right? So she still uses it, even though prasterone hasn't been FDA approved for lupus. But one of the pearls that she gave about DHEA is, number one, don't give it to a man, because it can actually produce estrogen. Number two, or convert to estrogen. Number two, don't give it to postmenopausal female. And then basically, it still can go and be metabolized to estradiol. And of course, there's also risk there for estrogens and lupus. So she does use DHEA. Now, another one that she mentioned is that, CBD, it's always the hot stuff here with lupus. Well, she's a little bit cautious with CBD in lupus patients because there's actually been a couple of reports where CBD can worsen lupus nephritis. And then the other thing is that medical marijuana, there's been case reports where it can induce vasculitis. So our patients, have so much to handle and to deal with. Why are we trying to complicate things? So you can get more information about some of these Petrie pearls. I'm actually writing a blog about this on rheumnow.com. Thank you.